Welcome to Doctors, a community dedicated to bringing women doctors together. How do you handle situations where the patients assume the male doctor is in charge and show bias towards the female doctors?
I have to go and attend somebody in the ER emergency. Probably a physician assistant will assist me, or a DMO will assist me. DMO who is a male.
Yeah.
And the DMO is post MBBS.
Okay.
They would like to address to him rather than to me.
Okay.
You understand?
Yeah.
We both go just because that guy is taller to me. He's heavier to me.
And what are the misconceptions, some of the misconceptions that people have about females in high stakes specialties?
And in the beginning of my career as a consultant, one tough patient, a very sick presentation, female doctor champesindi. This is what. So that bias is always there. People are biased towards it.
Do you have anything else to share with the viewers or young interventional cardiologists, aspiring?
Cardiology, if you're dreaming at cardiology, you have to be certain about it. You want it, you will want it, and you will do it. You will achieve it, that's all. Okay, no distractions, no change of plans. If you want a relaxed leisure life, don't talk cardiology. This is an amazing profession. You just tell me which other profession people are considered gods, you tell me.
Hello, I'm Purnima. Welcome to Doctors, a community dedicated to bringing women doctors together. Today we have a wonderful guest, Dr. Pragathi, an interventional cardiologist at AIG hospitals.
Hello friends, this is Dr. Pragathi Gurram. I'm consultant interventional cardiologist, currently working at AIG hospitals. So I am close to 20 years experienced in medicine. Then as a cardiologist, I am going into my 8th year. So we'll just have a brief discussion about the women in interventional fields. So here we go to Purnima.
Thank you, ma'am, for taking the time to speak with us. So what inspired you to choose interventional cardiology? What's your story?
Okay, I have a big time, real time story.
Sure.
It dates back to when I was in my 6th standard. People say that I thought this in my childhood and I did this, but then this is real. When I was in probably 6th or 5th standard, I had this infection called as acute rheumatic fever, so which has a tendency to affect heart valves in the future over years. So so you will be, otherwise, as treatment protocol, you'll be put on penicillin injections intramuscular once in 21 days. And then I had to see a cardiologist at least once in few months or so. And then, needless to mention, it was a male cardiologist, definitely. But then looking at the way he worked and the way he took care of people and hearts, I really got inspired. Then since then, even my friends know that I wanted to become a cardiologist since then. Yeah. But then over time, I actually forgot why I wanted to become a cardiologist in my childhood, but then the dream just remained. Till recently, or latestly, when I spoke to my mom, she mentioned that it is because of this that you wanted to become. I just remember, I wanted to become, that's all. It's a dream. But then why I forgot. But then she reminded me because it was of that cardiologist who treated me then. Luckily, my heart and valves are safe. But then
that is sweet.
Yeah.
Okay.
So luckily, I had many change of plans, not me per se, but then my parents wanted something else, probably because of the challenges that women face in interventional cardiology or any other aggressive branch. So I had many change of plans, which my family wanted to bring in, but then luckily I was persistent on this despite the change of plan, and somehow I navigated to this. So finally, this is what it is.
Yeah, that's actually inspiring.
We'll talk about that also, who supported me, how I got my support from the family, who was against it, who was for it. Yeah.
Please continue.
We'll discuss anyway. I think we have a lot to discuss.
Okay. So were there any moments in your career, being a woman, made things more challenging, like this particular moment or any?
both physical and mental.
Yeah.
Why not every month rather? Because
Yeah.
long tedious hours, intense sessions, both physically exhausting, mentally challenging. They just drain you out, especially in those days, when you reach your cycles,
Yeah.
pre cycle and your cycle especially. That is when I am actually drained, honestly speaking,
Yeah.
because you as well have your mood swings. You have to deal with your mood swings. You have to deal with your physical pains, where the work is still there. Work is constant. Work
true.
is never going to change. That is a personal and physical difficulty I face.
Okay.
But then otherwise health issues or family issues, but then this everybody is going to have, irrespective of the gender. So this is what you learn in your training period actually. That intensive sessions that you have during your training period, that will help you just keep going on. Yeah, now most of the times I manage to cope up. But then, yes, there are times
it is very demanding, especially.
It is definitely demanding. Sometimes you're just washing for a case. You won't even be able to, eat something or drink water or use a washroom, because lengthy cases, tough cases. Sometimes the patient collapses on the table, and then we have to sail through it 3 hours, 4 hours sometimes. Yes, it is. It is slightly more difficult physically for a woman than a man, definitely.
Yeah.
In these high demanding professions.
But still, you're being so amazing in your specialty. Have you ever faced gender bias from your colleagues or patients or institutions?
Gender bias. I'll start with the positive things.
Okay.
Luckily, nothing from my institute. I'm from AIG hospitals. My institute supports me, or as a matter of fact, any female doctor to the best ever possible. అంటే మేమేమైనా చేస్తామన్నా కానీ అంటే ఫర్దర్ అంటే సబ్ స్పెషాలిటీ ఆల్సో.
Okay.
Yes, they are there to support us. Via institute, I personally don't face any challenge. I never faced any challenge. I'm not expecting that I would face one ever. And you said colleagues.
Yeah.
You said. Luckily, colleagues also, they treat me, see, I will tell you. And at least during my residency, అంటే ఏదన్నా చిన్న కాన్ఫరెన్స్, ఈ అకాడమిక్ కాన్ఫరెన్సెస్కి వెళ్తే ఒక 40-50 పీపుల్ ఉన్న దగ్గర ఇట్ యూస్ టు బి హాల్ full of men. I was the only woman there. It used to feel awkward in the beginning, but then after that I got used to it. People also got used to me. Even now, most of the times, and a beat in a lunch session or whatever, most of the times it's at least 8 to 10 guys where I am the only person. Now they don't feel anything. They just talk normally. And casual jokes, casual conversations. Now they don't actually consider me as a woman there. So I'm just one amongst them. That equality is definitely there. But then current colleagues, I'm comfortable. But then I will tell you one of my experiences during my MD. MD అంటే నాకు కొంచెం MBBS తర్వాత బ్రేక్ వచ్చింది యాక్చువల్లీ. After 2 kids with my second child, I joined MD. Their colleagues, I know, అంటే being professionals, అంత స్మాల్ థాట్ ప్రాసెస్ ఎట్లా ఉంటుంది నాకు తెలీదు. స్టిల్ ఎ సర్ప్రైజ్ టు మీ. అంటే ఎలా ఉంటుంది అంటే స్టిల్ నువ్వు కొంచెం గట్టిగా నవ్వినా కానీ, కొంచెం కంఫర్టబుల్గా మాట్లాడినా కానీ, దే జడ్జ్ యూ. దే జస్ట్ స్టార్ట్ సేయింగ్, అంటే ఐ హ్యావ్ పీపుల్ సేయింగ్ దిస్ విచ్ అంటే నేను డైరెక్ట్గా కాకపోయినా, నాట్ ఇన్ రీసెంట్ టైమ్స్, ఎండి మేము ప్రాబబ్లీ 8, 9, 10 years అంటే డైరెక్ట్గా వెళ్ళలేదు. బట్ దెన్ యూ కమ్ అక్రాస్, రైట్? యూ విల్ నో ఇట్ ఈవెన్చువల్లీ. One of the guys who is my colleague, I will not mention his name anyway. He's also a super specialist now. And being a woman, being a mother, how can she laugh so loud? How can she talk so comfortable? Amma talli ayundi entra tantla maatladtadi. Itlantivi, I think it's the mindset. Irrespective of the profession, irrespective of the profession, people are like that. And he's also a professional. And I think this is deep-rooted. This is deep-rooted. It will take some more time. I think things are getting better for us. 99% of the time I'm comfortable, but once in a while you face or you come across things like this, then you should not get disheartened. So another thing. And then what else? Patience. Yes.
On daily basis.
On daily basis, and the heroes could have. And before I came here, one of the patients, we just wish. You just want to wish the patient,
Yeah,
whoever
yeah.
is on the table,
True, yeah.
Mr. X or Mrs. X, something like that. You just wish, how are you? Etla unnaru ante, baane unnanu sir. Sir, okay. I wish them twice and then they still say sir. Or you get a cross referral from somewhere in the hospital.
Yeah.
They come up saying, sir, can you see this?
Okay.
Okay, I repeat, I'm Dr. Pragathi. And then again they say, sir. And then I make sure they correct themselves.
Yeah,
Do you
you
hear
have
me out?
to.
I am Dr. Pragathi. It's a she, it's not a he. That's how I correct them. Or then they say, okay, oh, I'm sorry. That's because of the dominance.
Yeah.
I'm not saying men are dominant. It's the male number in the profession that is dominant when compared to the females. That's all. Dominance ni batti ante by default it is a male who will answer the call,
Yeah.
or by default it is a man who will address me, the patient's
Yeah.
perspective. Those are funny things. They're not offensive.
Okay.
They're not offensive. But then, yeah,
Okay.
there's a few things. But then it's okay. I'm coping up.
Okay. So, do you think the female interventionists have to work harder than their male colleagues to prove themselves?
Not harder to them, but then
Okay.
you just work hard. You work hard for yourself,
Okay.
not for them.
Okay.
As in, especially when I joined AIG, I was given an option of, అంటే యూజువల్గా అంటే మనకి ఇన్ని వర్క్ అవర్స్ ఉంటాయి, ఇన్ని డ్యూటీస్, ఇన్ని కాల్ డేస్ ఉంటాయి అని మాట్లాడుకుంటాం కదా. సో వెన్ ఐ వాజ్ ఆఫర్డ్ రోల్ దేర్, అంటే డ్యూటీస్ ఉంటాయి, బట్ దెన్ యూ కెన్ స్టిల్ ఆప్ట్ అవుట్. ఇఫ్ యూ డోంట్ వాంట్, యూ క్యాన్ ఆప్ట్ అవుట్.
Yeah. Yeah.
I said only one thing. I don't want any అంటే నాకు ఒక ఫీమేల్ అని నాకు
Yeah.
స్పెషల్ కేటగిరీ వద్దు. ఐఎమ్ గోయింగ్ టు డూ యాజ్ మెనీ నెంబర్ ఆఫ్ డ్యూటీస్ యాజ్ మై మేల్ కలీగ్స్ వుడ్. బట్ దెన్ ఓన్లీ థింగ్ ఈజ్ నాకు సాటర్డేస్ ఒక ఎగ్జామ్షన్ ఇవ్వండి అని అడిగాను. సాటర్డే ఆన్ కాల్ పెట్టకుండా, ఇట్స్ గోయింగ్ టు బి లెందీ షిఫ్ట్, 30-hour shift.
Yeah.
If I am there in hospital, I am there for the next 30 hours, my shift, my call days, because on call I prefer to stay in the hospital. It's a personal choice, because
Yeah.
I don't want to go back home and primaries vachna em vachna for whatsoever reason if I am delayed back in attending the patient, that's a concern. So I remain in the hospital. So it's a personal choice again.
Yeah, that's-
So it's going to be a 30-hour shift. That's what I said. So I don't want any exceptions or exemptions. అప్పుడు కూడా ఎందుకంటే my kids were in some other place, so I had to travel during my weekends. Few first initial 1.5 year మాత్రం Saturdays exemption ఇవ్వండి అని చెప్పాను, not Sundays, only Saturdays. But otherwise, yeah, you just work hard, that's all. You don't have to compete with anybody. You work your personal best, that's all. That's what I do. I advise you also. I know you are my junior, so.
So, have you ever been overlooked for any leadership position or any promotion?
No. No. Because after I joined this institute,
I mean,
it's institute.
just because you're a female.
Yeah, exactly. So after I joined, because I am academically oriented,
Yeah.
ఇనీషియల్గా అంత వర్క్ ఉండేది కాదు. అంటే ఆబ్వియస్లీ బిగినర్స్కి ల్యాబ్ ఛాన్సెస్ కానీ ఇవన్నీ కొంచెం ఆపర్చునిటీ తక్కువ ఉంటుంది కదా. సో టిల్ ద కన్సల్టెంట్స్ గెయిన్ కాన్ఫిడెన్స్. సో ద రెస్ట్ ఆఫ్ ద టైమ్ ఐ యూస్ టు యూటిలైజ్ ఇన్ టీచింగ్. ఐ లవ్ టీచింగ్. ఐ యూస్ టు టీచ్ ఫర్ అవర్స్ టుగెదర్. అంటే ఎవరు దొరికితే వాళ్ళకి, బీట్ డిఎంఓ ఆర్ ఎండీస్, వీ హ్యావ్ స్టూడెంట్స్ పోస్టెడ్ ఫర్ peripherals as a part of peripheral posting, or nurses, beat nurses also. I used to just catch hold of them. I used to teach for hours together. Now I am not finding that time, though.
Okay.
But then looking at that interest, I was made an academic in charge. So past 4 years, I have been taking care of the academics in AIG. So never. I think I'm only going to get better, or I'm going to reach higher positions. So far, not a remark I have left. Never a complaint against me. That part I'm confident.
That's
Yeah. So no. I don't see that. As long as you're hardworking, your work is going to be recognized 100%. There is no doubt in this.
So, how do you handle situations where the patients assume the male doctor is in charge and show bias towards the female doctors, interventional cardiologists?
I will just tell you a funny situation. Ante usually, if I have to go and attend somebody in the ER emergency, probably a physician assistant will assist me, or a DMO will assist me.
Yeah, true.
DMO who is a male.
Yeah.
And the DMO is post MBBS.
Okay.
That's
Yes.
all.
Yes.
But then they, అంటే they would like to address to him rather than to me.
Yeah.
You understand?
Yeah,
We both go just because that guy is taller to me, he's heavier to me. And then, ante వాళ్ళ personal problem, ante whatever the complaint they have come with. So, male doctor ki preference ఉంటుంది ఎప్పుడైనా. Probably because the build is like that. చూడగానే వాళ్ళ మీద కాన్ఫిడెన్స్ బిల్డ్ అవుతుందేమో మేబీ దట్స్ వాట్ ఐ అజ్యూమ్. సో పర్సనల్గా అంటే వాళ్ళు అంటే యూ అండర్స్టాండ్ దట్ ఐ కాంటాక్ట్, యూ అండర్స్టాండ్ ద వే దే టాక్, దే విల్ బి లుకింగ్ అట్ యువర్ డిఎంఓ, మేల్ డిఎంఓ రాదర్ దాన్ యూ, వేర్ that guy will be, you know, probably 12 years, 15 years junior to me, kind of, and just freshly passed out.
Yeah, yes.
10 years. Yeah, 10 years junior. And then akkada nenu akkada valaki ante how I deal with it is obviously I interfere them, and I tell them I am the concerned person to deal with the situation. I am so and so, this is my designation here. So you make sure you look into the attendant's eyes, you make an eye contact, powerful eye contact, you tell them the facts, you tell them what is going to happen, how you're going to deal with this. I believe strongly communication is the key. Communication and counseling regarding the disease, the treatment options available, the treatment options that you are capable of giving. Okay, all of those. I think communication. You need to communicate. Sophisticated communication. Facts to be landed softly. Show yourself that you are capable of dealing with the patient. Let the attendants gain the confidence in you. This may take a while. This may take a while because it's like another subject altogether.
True.
For the patients to have faith in you, because ante నాకు especially, more than being a male or female, by looks I look little younger to what I'm actually experienced.
Very true.
That is the problem I have. అంటే నా ప్రాబ్లం ఏంటంటే నన్ను చూడంగానే డిఎంఓనా అని అడుగుతారు మీరు. దట్స్ ద ప్రాబ్లం. ఆర్ యూ డిఎంఓ, ఆర్ యూ జస్ట్ ఫ్రెష్లీ పాస్డ్ అవుట్ ఆర్ సంథింగ్ లైక్ దట్. That is the problem I usually face, rather than this male-female gender bias. Jokes apart. But then, okasari in action, they will understand the person, because they don't have an option. For the night, I am their rescuer. They have to trust me. And then, and then one other thing, just in case, if they still insist on a male, I don't mind taking help from my male colleagues. It is okay. Ultimately, it is the patient's safety that is important. Akkada, I don't have to win my ego there. You understood?
Yeah,
because just because అంటే నేను ఫీమేల్ కార్డియాలజిస్ట్ అని చెప్పి, ఆర్ బికాస్ దే కుడెంట్ డెవలప్ దిస్ థింగ్ ఇన్ మీ, దెన్ ఒకవేళ పేషెంట్ని తీసుకెళ్ళిపోతాం అన్నారు అనుకోండి, హార్ట్ అటాక్ కదా, ఆబ్వియస్లీ గోల్డెన్ అవర్స్, గోల్డెన్ మినిట్స్, ఎవ్రీ మినిట్ కౌంట్స్. సో జస్ట్ ఫర్ ద పేషెంట్ సేఫ్టీ, ఇఫ్ దే ఇన్సిస్ట్, ఐ డోంట్ మైండ్ taking my colleagues' help for counseling. Ultimately, I'm going to deal with the patient. It is okay. It is okay to sometimes mask yourself. It's okay to be guarded. It is okay. It is absolutely fine. Ultimately, the final goal is the patient should receive the treatment. Appropriate and adequate treatment. That is what we aim at. So yeah, I don't mind taking my seniors' హెల్ప్. అంటే కొంచెం ఇఫీ డయాగ్నోసిస్ ఉన్నా, కొంచెం వెరీ సిక్ పేషెంట్స్ ఉన్నా కానీ, అంటే ఫర్ దెమ్ టు నో దట్ దెర్ ఈస్ అ టీమ్ ఎఫర్ట్, దెర్ ఆర్ పీపుల్ హూ ఆర్ యాక్చువల్లీ టేకింగ్ కేర్ ఆఫ్ ద పేషెంట్, నాట్ జస్ట్ మీ, బికాస్ ఐ మే లుక్ యంగ్ ఆర్ ఐ మే లుక్ లిటిల్ లెస్ కాంపిటెంట్ బికాస్ ఐఎమ్ ఎ ఫీమేల్, వాట్స్ ఎవర్. అక్కడ వాళ్ళకి ప్రూవ్ చేయాల్సిన అవసరం లేదు నా కెపాసిటీ ఆర్ కాంపిటెన్స్. అక్కడ పేషెంట్ సేఫ్టీ ఇంపార్టెంట్. సో ఐ డోంట్ మైండ్ యాక్చువల్లీ taking, somebody by their, it's okay. If they're confident by looking at them, it is still fine by me.
And what are the misconceptions, some of the misconceptions that people have about females in high stakes specialties, like say in interventional cardiology or surgical gastro surgeries?
Okay. And personally, నేనైతే challenges ఏం ఫేస్ చేయలేదు so far. In the beginning of this one instant, in the beginning of my career as a consultant, one tough patient, very sick presentation, he had a massive heart attack, major heart attack వచ్చింది. So more than one arteries lo block unindi. Major artery, LAD, must be knowing anatomy. So LAD was totally occluded, and then he had disease in circumflex and RC also, the other two vessels also. Okay, but then they were little reluctant to get the procedure done.
Okay.
It was around 8 o'clock in the evening.
Okay.
But then I tried to explain them. I explained them the criticality of the situation, the need for revascularization. The artery open cheste gaani survive avadu, all of it. Okay, I could convince them. They got convinced. Procedure was successful. LAD I successfully revascularized. Artery open chesesanu అయిపోయింది. తర్వాత పేషెంట్ వాజ్ నాట్ ఈవెన్ he never needed ICU also. And after revascularization ఆ rhythm issues అన్ని సెటిల్ అయిపోయినాయి. He was almost stable on table. So we shifted him to step down ICU actually. Step down ICU వెళ్ళాక అక్కడ he threw a VFib.
Okay.
And he had a cardiac arrest there. So again, within 2 minutes we addressed. We shifted him back. మళ్ళీ యాంజో చేస్తే స్టెంట్ బాగానే ఉంది. పక్కన వేరే వెజల్స్లో ఎక్కడైతే బ్లాక్స్ ఉన్నాయో వన్ ఆఫ్ ద ఆర్టరీ గాట్ అక్లూడెడ్, సర్కంఫ్లెక్స్ గాట్ అక్లూడెడ్. దెర్ ఇస్ సంథింగ్ కాల్డ్ ఎస్ ఇష్కీమియా, ఇన్ఫ్లమేషన్ అట్ డిస్టెన్స్. అంటే మెయిన్ ఆర్టరీ అక్లూడ్ అయినప్పుడు ఇట్ సెట్స్ అన్ ఇన్ఫ్లమేషన్ క్యాస్కేడ్. సో దాంతో వేరే టెరిటరీస్లో కూడా బ్లాక్ అయ్యే ఛాన్సెస్ ఉంటాయి. ఓకే, సో దట్ ఈస్ వాట్ హెస్ హ్యాపెండ్. స్టెంట్ వాజ్ పేటెంట్ విత్ ద అదర్ ఆర్టరీ గాట్ అక్లూడెడ్. But ultimately my seniors were also there, they also joined, but none of us could rescue him. See, multiple factors, because heart attack is and the patient is never stable till he is completely stable. Even if he goes back home also, we never know. Still that 2 to 3% risk is always there. It is the nature of the disease. But then this is too large a fact for people to understand.
True.
And then అంటే వాళ్ళు అక్కడ అన్నది ఒకటే, ఫీమేల్ డాక్టర్నే మారుది. You understand?
Okay.
Female doctor champesindi inte. This is what. So that bias is always there. People are biased towards it. We are, again, I'm reinforcing, we are getting better. Culturally also, we are becoming more sound. Going forward, future decades, I am seeing a much better population where they accept women in all high stake positions. One other example I will give you, not a personal experience, but a friend of mine. She is you asked in surgical fields, kada? So she is a surgeon.
Okay.
But she is practicing in peripheries.
Okay.
Hyderabad lo cheyatledu tanu. Peripheries lo chestuna. I wouldn't mention the details. తనకి కూడా తనకి ఏంటంటే actually she has a very good hand. She is a very good surgeon. She has her own hospital, కానీ clientele build అవ్వట్లేదు. So what she did was, there is another partner, so ఇంకొక సర్జన్ని హైర్ చేసుకొని they showed that surgeon, male surgeon obviously, so his face was seen to the people, but then hindsight lo she was operating most of the cases. Just to build up that volume, she had to hire a male surgeon, where that male surgeon is junior to her, less competent to her, but then face was his, she was operating. These are a few examples. No offense, but it is going to take a while for people to accept.
So ma'am, have you seen gender diversity since you have started, like females more in interventional cardiology?
Yes, definitely. ఇప్పుడు నాకు జూనియర్స్ ఉన్నారు ఇద్దరు రెసిడెంట్స్. Numbers are increasing.
Okay.
Definitely numbers are increasing. We are positive.
That's nice.
అంటే ఫస్ట్ ఆఫ్ ఆల్ people are hesitant to opt cardiology ఇప్పుడు.
Okay.
Considering, long hours,
True.
tedious sessions, brainstorming, స్ట్రెస్. అంటే ఇంటికి వెళ్ళినా కానీ నీకు పేషెంట్ ఏమవుతాడో అన్న స్ట్రెస్ ఉంటుంది. అది సింగిల్ ఆపరేటర్స్ ఉన్న సెంటర్లో దట్ ఈస్ మోర్. ఎందుకంటే ఎనీథింగ్ అంటే పీపుల్కి యాక్సెప్టెన్స్ ఉండదు. ఎందుకంటే నేచర్ ఆఫ్ డిసీజ్ మనకు తెలిసినంత వాళ్ళకి తెలియదు కదా. దే డోంట్ అండర్స్టాండ్. దే ఓన్లీ థింక్ దట్ పేషెంట్ నడుచుకుంటూ వచ్చాడు, చచ్చిపోయాడు, ఇంతే. దట్స్ ఆల్. So
and yet numbers are increasing.
Numbers are increasing, definitely.
What do you think has changed, like upper nunchi?
I think the confidence. Confidence in women, because cardiology is an exciting branch, man. I mean, come on.
True, very true.
అంటే ఎంతమంది చెప్తారో కార్డియాలజీ ఇష్టం కానీ తీసుకోలేకపోయాను, కార్డియాలజీ ఇష్టం కానీ చేయలేకపోయాను, కార్డియాలజీ ఇష్టం కానీ డ్రాప్ అయిపోయాను అని చాలా మంది చెప్తారు. కార్డియాలజీ ఇస్ దాట్, ఇట్ గివ్స్ యూ దట్ హై. అంటే వన్ లైఫ్ యూ సేవ్ లడీ, ఇట్ ఈస్ అంటే ఇట్ విల్ జస్ట్ కీప్ యూ పంప్డ్ అప్ ఫర్ ద నెక్స్ట్, డోంట్ నో హౌ మెనీ డేస్ బట్ యాక్చువల్లీ one positive result. Blips ఉంటాయి 1 to 2% cases sick అవుతాయి, but then you learn to balance those emotions. Yeah, first of all medicine మీద awareness పెరుగుతుంది, so women in medicine are increasing. Likewise the interest in cardiology, or the, you know, they are probably they're more brave now.
True.
Yeah, and then and I personally am excited looking at many interventional cardiologists worldwide. They're amazing women. It's mutual inspiration and mentorship.
Work-life balance. How do you balance it with your work and personal responsibilities?
Work-life balance. That's an amazing question. All of us should know how to balance our lives. I personally, what I do, I I try my best to balance it. Sometimes that tilt is expected. Kind of what I do to make it better, I actually make a plan. I schedule it. I schedule my day. I schedule actually my whole week. I will know. Sunday I will know what I'm going to do the next 1 week.
Okay.
I will know. And if I have anything important, I make a, you know, I just note it in my diary, things to do next day. Be it phone calls, because కొన్ని కంపల్సరీ చేయాల్సినవి ఉంటాయి. అమ్మకి ఫోన్ చేయాలి, అత్తకి ఫోన్ చేయాలి, మర్చిపోకుండా కొన్ని కాల్స్ ఉంటాయి కదా, అవి కూడా నోట్ చేసి పెట్టుకుంటాం. ఆర్ ఓకే అన్నయ్యకి ఫోన్ చేయాలి, ఆ పేషెంట్ బాగాలేదు, ఆ పేషెంట్ అటెండెంట్తో మాట్లాడాలి, సో జస్ట్ మేక్ ఏ నోట్. మోస్ట్ ఇంపార్టెంట్ థింగ్స్ టు బి డన్ దట్ డే, I make a note. So strategy important. What you're going to do the next of few days important. ఎందుకంటే you are holding multiple responsibilities here. You're not just a doctor, you're a wife, you're a mother, you're a daughter, you yourself are a daughter.
Yeah.
And you are you also. So you are holding multiple responsibilities. So you have to be little smart. So strategy is very important. Planning is important. Support is very important. You need to have a strong support system. Luckily I have it.
Okay.
I definitely have it. లేని వాళ్ళు, I don't know, but then yeah, లేని వాళ్ళు నిజంగా if they opt for such fields, yeah, I think they will have some amount of compromised life ఉంటుంది వాళ్ళకి, అంతే కదా.
Yeah.
But I luckily have a strong support system. And then me time, self-care is more important.
True.
I actually don't have time to ease out, అంటే పార్టీస్కి వీటికి టైం ఉండదు, బట్ దెన్ ఐ మేక్ షూర్ ఐ ఎక్సర్సైజ్. దట్స్ మై మీ టైమ్.
Okay.
Self-care, because
True.
if you are fit physically, it will make you fit as well mentally. You're not tired at the end of the day. You can do your things much faster and you can accommodate more number of things. That's what I see. That's what I look at it. And so morning every day, at least 4 to 5 days a week I exercise. That will keep me active throughout the day. Otherwise alle apron eskoni andani gantal pan cheyalemu. It's not easy, because that apron itself will weigh close to 8 kgs untundi. Like radiation effects at the end of the day, you are just burnt out. Okay, radiation is bad. So all of it, self-care, exercise, diet, water intake, more fruits you consume, more vegetables you consume. You have to be more mindful of what you're eating, how much are you eating, exercise. So self-care is also equally important, because that will make you a better person on the whole.
Yeah.
Be it at work or family or relations or emotions. Still, I will not say I'm there. I'm still learning how to balance my emotions, because sometimes you get frustrated, you're worked out, because that's what it is. You have your kids' exams. You have every patient is an exam for you again. And then the volume of work you have, the night calls that you have. Oka night call correct ga manaku oka night full night disturb ayipindi anko, it will take 2 to 3 days for you to recoup.
Yeah.
Without sleep. All of it. But then I'm learning. I'm getting better. I think I'll get better.
Okay.
Consistency.
Noted.
Keep doing it consistently.
Yeah, because I'm also trying to manage.
Consistency. You do it every day, you're going to get better at it.
Okay.
Did I answer?
Yeah.
Did I?
Yes, you did, ma'am. Very excellently, actually.
So strategy, planning, self-care, keep practicing, keep improving yourself.
That's nice.
Just don't think that you're a female, that's all.
Okay.
Don't self-pity. No self-pity.
Yeah.
Don't empathize yourself. Be hard on yourself. Be stubborn. It's absolutely fine. You're going to be good. You'll only get better.
Yeah.
100%.
Do you think mentorship, the importance of mentorship to young cardiologists?
Future generations.
Yeah.
To me myself.
Yeah. True.
Yes, mentorship is very important.
Okay.
You asked me earlier how are the numbers going on? Numbers are actually increasing. I would definitely say you need an active mentorship. Okay. Because see, my juniors especially, you set an example to them.
Yeah.
They see you acting like how your child will grow looking at you. He or she will get inspired by you. They just act like you. So you set a right example for your juniors by doing the right things. You actually don't have to be oral about it all the time, but then you do the right things. They keep watching you. They will learn it from you. They just become like you. Okay. And then you keep telling them, because especially if you ask me about females, it's not like a soft corner I have, but I know what I have gone through. So I don't mind giving them those advices which will easen it out for them. అంటే జూనియర్స్ ఇద్దరు వాళ్ళకి ఇంకా పెళ్ళి అవ్వలేదు లక్కీగా. సో ఇప్పటికైతే పెళ్లి చేసుకోవద్దు, అయిపోయిన తర్వాత చేసుకో అని చెప్పాను.
So you actually mentor your juniors? Yeah.
Yes. Because I said I like academics.
Okay.
I make sure I attend their presentations. I make sure I give them a questionnaire, keep a constant check of how they are growing, how they are reading, whatsoever best possible. Academically, I help them, and then practically they'll look at you and they'll learn.
Yeah.
And then you keep correcting them. They will also have their emotional disturbances. So whatever feels correct, you just do those corrections. Yeah. Mentorship is very important. Formal mentorship, I think, as a routine also. Yeah, it has to be inculcated. Your ability to mentor somebody, I think దానికి కూడా కొంచెం మనకి ట్రైనింగ్ సెషన్స్ ఉంటే ఇంకా బాగుంటుంది. Because it's always, every person will become a mentor. So your future generations are going to be much stronger and brighter.
True. Yeah. So where do you see the future of women in interventional cardiology?
There. Top. Top, definitely. Because we are not relaxing.
Yeah.
Because probably, I think, we talk of equality so much, but I think undergrounded thought process, okay, maybe, అంటే ఇప్పుడు మీరు అడిగిన క్వశ్చన్స్ అన్నీ నాకు ఎప్పుడో ఉండుంటాయి ఆ ఫియర్స్ అన్నీ. అందుకే ఐ నెవర్ వాంటెడ్ టు టేక్ అ హ్యాండ్ స్టెప్. దట్ ఈస్ ద రీజన్ ఐ వర్క్ much more without comparing myself with anybody else. Try to give my personal best. I think ఇప్పుడు కార్డియాలజీని ఆప్ట్ చేసుకునే వాళ్ళంతా ఇదే డిటర్మినేషన్తో వస్తారని నేను అనుకుంటున్నాను. అదర్వైజ్ ఇఫ్ యూర్ నాట్ డిటర్మైన్, డోంట్ ఆప్ట్ ఫర్ కార్డియాలజీ. ఇట్స్ నాట్ యువర్ కప్ at all. If you want a relaxed life, it's okay. It is still okay by it. It is a personal choice. It is a personal choice. Not any profession is less, not any profession is more. It's just what you want. Why you do it constantly. If I get demotivated and then I ask myself, this I wanted this, and this I'm going to have, so I have to face it. That's all. So I see women there, top notch. Future generations, top notch cardiologists are going to be women. It's a secret.
As you've mentioned earlier, women are 27% less likely to receive CPR. Why do you think?
Okay, multiple reasons. Most important, అంటే విమెన్కి కార్డియాక్ ఇష్యూస్ తక్కువ ఉంటాయి అన్న మిస్కన్సెప్షన్ ఉంది. That's a myth. That the incidence of cardiac diseases is much less in women. People think that అంటే విమెన్కి హార్ట్ డిసీజెస్ తక్కువ అన్న మిస్కన్సెప్షన్ స్ట్రాంగ్గా ఉంది. సో ఎప్పుడైనా పడిపోయినా కానీ అంటే వాళ్ళు కార్డియాక్ అరెస్ట్ అయి ఉండకపోవచ్చు అన్న దాంట్లోనే ఎక్కువ ఉంటారు. సో ప్రాబబ్లీ ఇట్ ఈస్ నాట్ అ కార్డియాక్ ఇష్యూ. వన్ అజంప్షన్. సెకండ్ అజంప్షన్, విమెన్ ఆర్ మోర్ ఫ్రెయిల్. దే ఫిజికల్లీ ఫ్రెయిల్ అండ్ ఫ్రజైల్. సో అంటే సిపిఆర్ చేస్తే మనం ఏమైనా ఇంజురీ చేస్తామా అన్న ఒక ఫియర్. ఆర్ లెట్స్ సే fewer scared to touch women. అంటే ఈ inappropriate touch అని ఆర్ ఈ అసాల్ట్స్ మీద కేసెస్ అక్యూజిషన్స్ ఎక్కువ అవుతున్నాయి కదా, సో అదొక ఫియర్ ఉంటుంది. అంటే ముట్టుకుంటే ఎట్లా ఉంటుంది తర్వాత, విల్ ఐ బి అక్యూజ్డ్ ఆఫ్ టచింగ్ అ ఉమెన్ ఇన్అప్రోప్రియేట్లీ ఈజ్ వన్ ఫియర్, ఆర్ ద డామినెంట్ ఫియర్ ఆర్ ద మోస్ట్ ఇంపార్టెంట్ ఫ్యాక్ట్ ఆఫ్ వై women receive less CPR. Or yeah, let's say అంటే if you have a AED also, defibrillator ఉన్నా కానీ ఎస్పెషల్లీ ఇట్ హ్యాస్ టు బి ప్లేస్డ్ ఆన్ ద బేర్ స్కిన్. బేర్ స్కిన్ మీద అంటే బేర్ స్కిన్ మీదే ప్లేస్ చేయాలి పెడల్స్. సో అంటే ఉమెన్స్ బాడీ ఎక్స్పోజ్ చేయొచ్చా లేదా, ఓకే, ఇవి కొన్ని ఫియర్స్ ఆర్ ల్యాక్ ఆఫ్ ప్రాపర్ నాలెడ్జ్ ఆర్ స్కిల్, which is most important because CPR is a basic life skill everybody need to acquire and it comes with practice. అంటే మనం mannequins మీద ట్రై చేస్తాము, బట్ mannequins essentially are flat chest mannequins, male mannequins కదా, so they simulate a male body, or because of lack of the skill, even though they practice, that is one other thing probably. So all of it put together, so that is the reason probably we as well need female mannequins for people who wants to learn. There are many people who are coming forward to learn CPR because of increasing awareness, because it's called a basic life skill, but then it's the most advanced skill that somebody can acquire, because outside hospital cardiac arrest, that's the only way where you can actually safeguard someone. All of these, but then the facts are the same. Women are at similar risk as much as men. They can also have cardiac diseases. The numbers are almost equal. Post-menopause, the rates are almost equal. Ante pre-menopause, still estrogen hormone koncham protective women ki. Kani once menopause is achieved, the risk is going to be the same. As well, for women, the symptoms are going to be atypical. Cardiac symptoms per se, men lo ela untayo, women lo ela undavu. So most of the times, women ignore their symptoms. Okay. So thing to understand is the rate of incidence of heart diseases is as much as in men. Okay. Women also need CPR because at the end of the day it is a life. Gender will never come into play, be it a male, female or a transgender. Any living thing or human especially has to receive a cardiopulmonary resuscitation. Okay. So never hesitate, be it a woman also. It is okay. You will be accused probably later on, but then you are saving the human. And then as said, we need female mannequins.
So what support system were crucial to you, like both professionally and personally?
Personally first. Personally, my family has been a strong support system. My mother, my second mother, my mother-in-law, and the rest of the family, and my husband, who motivated me when I was a little lost, who constantly motivates me even now, who is always available to help me and to guide me. Family, perfect. I have a very solid support system. Professionally, my mentor, I have an amazing mentor. Otherwise also I have those traits in me, but I am refining those looking at him. He's the fastest operator ever I have seen. He's the fastest man where he can triage patients. Many things I have learned from him. I am learning from him. Both ways, be it personal and professional, I have good support system. I hope all the female cardiologists should have these things, maybe basic. Without this, I don't think it is possible to be best at what you're actually doing, at least in such professions, demanding professions where the support system is strong. So marry somebody who actually will support you. Munde ani maatladukoni support chesta antane pelli cheskunta.
Before we wrap this up, you have anything else to share with the viewers or young interventional cardiologists, aspiring?
Okay. Cardiology, if you're dreaming at cardiology, you have to be certain about it. You want it, you will want it, and you will do it. you will achieve it. That's all. Okay, no distractions, no change of plans. If you want a relaxed leisure life, don't opt cardiology. It's not going to be easy. నేను అది కూడా చెప్తున్నా. It is not going to be easy. It is going to consume most of you, sometimes all of you also. But then be ready for it. But then at the end of the day, the high it gives you, I think nothing
is
else,
worth it.
nothing else will match to it. Yes, if you are aiming for it, just go for it. Don't have a second thought. It is an amazing branch. You will master it. You will master both your profession and the family. It's only persistence. It's only persistence. You keep doing it. You keep doing it. Your speed will get better. First thing. So your time is saved. You know where else to invest that time.
Yeah.
You try to make boundaries to your work. Work-life balance is important, very important. Never neglect your family or children, because if your family is neglected or there are disturbances in your personal life, you're not going to be a better professional person. You need that balance. I totally understand. In India, countries like India, work is demanding. Yeah, for doctors especially, it is very, very, very demanding. But then you should know where to stop yourself, how to stop yourself. I have seen many doctors who are separated or divorced,
Yeah.
or children who are neglected. No offense to anybody in particular, but it's the fact. That is because owing to the busyness of the profession. But then this is an amazing profession. You just tell me which other profession people are considered gods. You tell me.